Welcome to Startup Health Now, the weekly web show that celebrates the healthcare transformers and changemakers reimagining health. My name is Unity Stoakes, and today we are here with a very special healthcare transformer, Hunter Howard, who is the CEO and founder of Hormone Therapeutics. Stick around, it's going to be a great show.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say be solved if we have the will, the courage. The future is to those who take it.
Let's talk a little bit now about Hormone Therapeutics.
Right.
You've got a very exciting new company called Hormone Therapeutics. First of all, what is Hormone Therapeutics, and maybe share your vision?
In Hormone Therapeutics, we understand that people are living 64% longer than they did 100 years ago. Average age of life then was 48, now it's 78. And so as your endocrine system gets depleted, it affects your energy level, your fatigue, your sexual function, your ability to, your bone density, all these important things that people are ignoring because they think it's a normal part of aging. When your eyes get depleted, you wear glasses. When your cardiovascular system has issues, you're going to see a doctor about this. It's no longer just the philosophy that we're getting older, it's normal, don't worry about it. No, you're not going to live an effective, happy, healthy life unless you also treat your endocrine system the same way you treat the rest of your body.
So there's a lot of focus on longevity, and there's a very, the aging population is a global challenge, really, as people are living longer. It's interesting, I think you're focusing on a very important aspect of aging, which is taking care of yourself as you age. I'd love to learn more about that, because I think there's companies helping people live longer, but not enough companies focusing on how well you're living as you're aging.
We have so many people that come to us and are like, I just don't feel the way I used to feel. My doctor says it's normal, you're aging. It doesn't have to be that way. So your endocrine system gets depleted, and we're looking at the symphony of kind of endocrine organs throughout your body, and they all need to be working in concert with each other. And so one might get depleted, your total testosterone might be up, your estrogen level might be down, it might be reversed, whatever. There's so many things that have to be kind of monitored and optimized for you to feel and operate the way you used to. It affects you tremendously, but here's also what we're learning. Last 15 years, they did a study of 83,000 U.S. veterans, and they showed that men with low levels of testosterone supplemented back to normal levels of testosterone have lower incidence of heart attack, stroke, prostate cancer, and mortality. So as your endocrine system gets depleted, it is affecting the way your whole body operates, and we need to start treating that the same way we're treating other areas of your body.
So you're building a virtual health management platform. And I think it's very interesting. You're sitting at the intersection of some pretty big macro trends. You've got rising demand for concierge health or more health services. You have telehealth and consumer health playing into that. And then you have an aging population and a need really to focus on longevity and all the issues associated with that. Talk to us about this virtual health management platform and how you're thinking about really solving some of these big issues and using these big macro trends to solve them.
It's interesting. As being an entrepreneur, you go into it with a vision of what you're trying to accomplish, but as you get in, you also see many other opportunities. And that's what we're doing right now. Is we're starting with Hormone Therapeutics as our first service line, but we're creating this virtual health management platform. We've got 50-state telemedicine network of physicians. We've got 4,000 lab blood testing locations around the country, with the ability to send a phlebotomist to any home in the country. And there's really kind of four pillars to what really gets us excited about where the future of healthcare is going. And the first one is the consumerization of healthcare, and that's we're seeing lots of great companies that are coming out right now with on-demand, anywhere, anytime physicians. And it's really kind of the patient-centric nature of healthcare, where for the history for all our history, it's all been about the doctor's location and his schedule and when you can find time to see him. Now it could be around the patient's location, their schedule, and finding the right specialist wherever they are, to help them out. Second is, so you got the personal. Second is the personalization of healthcare, taking the blood testing, taking the genetic testing, taking tracking of your exercise, your diet, your sleep patterns, and helping figure out everybody's unique, and so not every health solution is the same for everybody. So you need to look at what's happening with that individual and prescribe a plan specifically for that individual. And then the third is access to specialty physicians. So, a lot of these great platforms out there right now are on-demand acute care. We're doing chronic care with specialists in an area that's going to help you deal with certain situations that are happening in your life that you might not have access to in the Topekos and the Springfield of the world. That's what we're doing with Hormone Therapeutics, where we're in patients in 40 states right now, helping them live the best life. Dr. Kevin Light wrote the book Out Smart Aging. He's written all of our medical protocols. He is somebody you can't even get on his schedule in Dallas if you wanted to go see him, but he is helping us with all our medical protocols, but then also helping us with the more unique cases where somebody needs additional level of help. When we're finding different specialist doctors in all those different areas to form our platform. And then the fourth is the big data, the analytics side. My background at Dell, my big corporate background is philosophy. If you cannot measure it, you cannot manage it. At Metagain, when we started a medical billing company on the other side of the world, we measured hundreds of thousands of unique processes every single day. And so we were able to take individuals that didn't know what an insurance claim was, but manage the process in a certain way through big data, through metrics that allowed us to have these individuals perform at a much higher level than anybody was in the U.S. And that's what made our operations such a great opportunity for the private equity companies when they were looking at us. But taking that data and making it available, for the individual, helping their personal health coaches, the nurses and the doctors that are working with them, empower them with data and information, and create a virtual health map to their healthiest lifestyle possible.
So you're really bringing together four very important areas. You said consumerism, you said personalization, access to specialty care or doctors, and then big data and analytics. Very, very powerful. And so you've got a very big vision for where you're taking this.
We're incredibly excited about this. And so this virtual health management platform is going to help people take control of their own health, get access where needed, give them the map to really a better, healthy lifestyle. And so this is, these four pillars I think are really the ability to help people manage their own health in a way that we haven't been up to this point.
What have been some of your biggest lessons learned, just either with your current company or over the years in terms of being an entrepreneur? Mm-hmm. Lessons that maybe we could pass on to other entrepreneurs thinking about coming into healthcare, perhaps for the first time.
You need to surround yourself with amazing people, and people that will contradict you and give you a different perspective, but also people that share a vision of how you can change things. And healthcare. Dallas is a great healthcare city. It's got 3 of the 25 biggest healthcare systems in the world. But also people see healthcare in Dallas as, let's build another hospital. Let's go through a very traditional model. So how do you need to surround yourself with people that really are transformative and can see where we want to go and can help you figure out how to shape that vision. So surrounding yourself with those type of people has been a really important part of helping to keep on pushing the envelope for how do you transform things. Yeah,
so how do you find great people to surround yourself with, and how do you leverage them in your mission, what you're doing?
Yeah, it's really important to go out and find those people that will challenge you and help you think differently than the path, and make sure you're bouncing those questions on, is this the right path we're taking, but also to push you further. And for me, YPO has been one organization I've been in that surround myself with other leaders. Actually, one of the reasons I'm so excited about being part of Startup Health is that other healthcare transformers, these guys that are excited, these have batteries that are so highly charged to help us figure out how do you push the envelope. There's all these entrepreneur organizations around the world, and so reach out to some of those. Startup Health has been great to find some of the best healthcare entrepreneurs in the world, and that's one of the reasons why I'm here.
If you were to tell yourself, one piece of advice, your younger self, maybe 10 or 20 years ago, what would that be?
10 or 20 years, I guess, trust your instincts, and then, find people to work with to help you come up with the right solutions. But just because other people don't see the future the way that you do, take what they see, take that information, but make sure it doesn't kind of distract you from what you see as and what you believe is possible.
Wonderful. So we talked a little bit about the longevity movement, and there's wonderful companies like one of our other fellow healthcare transformers, Human Longevity Inc. and Dr. Craig Venter, really focusing on people living longer.
Right.
Describe the future. What does it look like for consumers out there who are now living longer, now that they will have access to a solution like yours?
Yeah, it's amazing. As we said, we're living 64% longer than we did just 100 years ago. And so as your body is kind of, dealing with the issues of aging, that's only going to increase. Human Longevity, amazing company, the best geneticists in the world. They're going to try to make us live 50 years longer. So how do we give people a map to living as healthy as possible, to have an optimized life? If you're just living longer, you need to have the energy, you need to have the mental cognitive capacity. You need to be taking care of yourself so that you're going to enjoy the life and be as effective, efficient, and happy as possible. And that's part of our mission, is really helping people live that life so that as we live longer, that they're going to enjoy those years and be as productive and efficient as possible.
So how do you take care of yourself? How do you relax? What are some of your personal hobbies that help you maintain that efficiency?
Yeah, as most entrepreneurs, I work too hard, think about work all the time. But I love it. That's why I'm an entrepreneur. One of the best things that I can do is I love to travel. I'm passionate about kind of exploration, and I've been to 97 countries. I am just always looking. The more raw, the more different an experience is, the more it kind of allows me to disconnect from kind of what I'm worried about entrepreneurially. And so I just got back from business meetings in Dubai. We're talking about kind of international expansion, and on the way there, I took a side trip to Jordan and went to Petra, where they filmed Indiana Jones and the Last Crusade. And so when you go to a place that's over 2,000 years old, where was the intersection of commerce on the Silk Road between the Eastern world and the Western world, and you see the people are actually living the exact same way, and kind of watch how they operate and just embrace yourself with the local customs, it helps you just think differently and take a step back and enjoy kind of the smaller moments in life also, when you see the goat herders that are living there and just kind of there enjoying their dates or their tea. And those experiences are so meaningful to me and kind of help me take a step back and also appreciate my life more when I come back to the U.S.
Do you think more entrepreneurs should spend time traveling?
Travel takes two things that nobody in the world has enough of: time and money.
Right.
And so you need to find a way to disconnect. And everybody's got their solution on how they can disconnect, and then they can come back, recharge, and come back stronger. And so for me, that's what I love to do. Exercise, you've got to exercise, you've got to sleep well, you've got to eat well, and find some things that allow you to kind of disconnect and come back. It also helps you think more creatively, to be able to do that.
So what are you most excited about for the future?
And we are really excited about working with people in this space and kind of helping them map out their future, helping them live a healthier lifestyle. So it's I'm really excited, kind of the people that we're talking to every day, just helping them just live more effectively, live more efficiently, live more happily. And it's I enjoy talking to the patients as much as possible, actually. And so really helping them in their lifestyle, I love it.
Wonderful. Well, thank you so much for everything that you're doing to help people not only live longer, but live healthier and better lives while they're aging.